Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better in veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Just go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need. So Wendy, and great question, by the way, Amy. So Wendy, is there an easy way to release palatal gingiva for ease of closure without damaging tissue, especially on 109 and 209? Again, that's 109 and 209 are advanced sections. Few people get to those in the wet labs. They're much more difficult, but we do teach them. And once you do them, you get competent, but you have to practice. They're difficult. So no way that I can really answer that question without actually pictures and videos and you watching those and going through those. So sorry, Wendy. Beth Sean, can you discuss an approach to extraction of a fractured incisor when the crown is no longer present? Is there a method of making a flap, or do you place the elevator blindly and luxate the root fragment? You can do a flap on those. If you're going to, I would do it on one side, do an envelope on the other side, so it's a triangular approach. But if you can, above all, don't do a flap. Clean the area with a diamond football burr so you have visualization. Have a technician do air, water, and then air to see the root and where that root whole periphery is. And then you can take a little half round burr and make a moat around the whole periphery in the bone and then wedge that out. That's the way we generally recommend doing that. And making a flap, you can do that as well. And again, that requires a lot of images, and we don't really cover that in this case. Good question, but a lot more learning needs to happen, a lot more teaching needs to happen in order to get you to that point where you're comfortable doing the flap unless you know exactly where to place that. How often does pulpitis lead to tooth root abscess? It generally doesn't. We don't generally see tooth root abscesses. We see lucencies where we have a radiographic change where there's lack of bone around a tooth root, but that's not an abscess per se. The abscess, with quotation marks around it, is more the fistula that people are referring to when you get a suborbital fistula from a periapical lucency that gets to the dermis and exposes the bone and that tract to the skin bacteria. When you extract those teeth, if you've got a tooth that's got that change on the apex, it's more a gray, cream colored, and it's gel-like, or it could be granulation-like, where that bone has been destroyed and replaced by that tissue that causes that lucency. Abscess, generally not something that we see in veterinary dentistry. Not that it can't happen, but it's generally not the case. Was there any bone loss in the furcation or growth abnormalities of 208 as well as 207? It looked maybe like some things, thinning of the bone, infurcations on 208 on rads, and that's a great question, Teresa. You might have had a little bit of that, but you have to be real careful because the bone is thinner there naturally. As you go up toward that root apically, the bone gets thicker, so you can't read too much into that. You want to probe, number one. If there are probing deficits on the palatal side or on the mesial side, yes. If there are no probing changes, you can still have significant furcation loss. So if you see that where there's not a question as to that lucency between the two roots, then you've definitely got some furcation changes. But we didn't have anything significant on those two that you're mentioning. Kyle, what are the firmest objects and toys you recommend owners to let puppies chew to reduce the risk for these and other dental lesions? Anything that you buy that is in the store that's hard. All these pet superstores have racks and racks of all the stuff that keeps us busy doing root canals and extractions on fourth upper premolars and first molars and canine teeth, mainly the back caudal cheek teeth. So anything is hard. Bully sticks, probably number one, nylobones, rawhide, antlers, all that stuff that people say, my vet recommended it, or the pet store didn't tell me this was bad. All those are bad. We see them every day in practice for pulp exposure. So really, CET chews, tartar-controlled chews, those can be used. They chew them quickly. They swallow them. You have to be prudent in watching them to make sure they're not going to inhale either of those and cause problems. Greenies are okay. Anything that's on the vohc.org website are good recommendations for any of those. But home care, we recommend Healthy Mouth Water Additive and Orbet Chews for the most part for dogs. Always, Cindy, do we always recommend extracting devitalized or discolored teeth? Can these be saved? If they are discolored and they're intrinsically stained and it's not generalized, because sometimes you'll get generalized staining from other things like tetracycline compounds as puppies. But if it's an individual tooth and it's discolored, it's gray, it's pink gray, it's black, that tooth is dead or dying, and that's either a root canal or extraction. And this falls into that category too, guys, of what we talked about earlier with client education, of it's tough for an owner to proceed to making a decision on a discolored tooth because the tooth looks fine, it's just a weird color. So this is where client education comes in, showing pictures of what can happen with these when we get them where there's black soup and a huge periapical lucency and or mandibular or maxillary fistula from years of that tooth being dead and the pulp, necrotic byproducts getting out, destroying bone and tissue. Images like that, or you can explain that's what happens if you don't have images, but these need to be extracted, or if the owner wants to save them, we can often do root canals on these and save them as well. Yes, Paula, we use bupivacaine solely as our agent of choice for nerve blocks, and we use that solely. We don't use buprenorphine with bupivacaine anymore, and because it doesn't appear to add any value in dog and cat patients based on a recent study done at Wisconsin. However, bupivacaine by itself may offer as much as 72 hours of analgesia to the cases post-administration for local blocks. That's our take on that. We used to use lidocaine and bupivacaine, and we used to add buprenorphine, but we don't do any of those. We use bupivacaine solely anymore. And Marcaine is bupivacaine. It's just a brand of bupivacaine. I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org/INV.